Hi. Okay. I'm coming in tonight again for you. You remember me? Maricel, huh?
Okay, so we've had some happy news today. We got advanced to a soft diet, and we turned down his feeding to half 50.
Oh, okay. What time? Like
it was around 1:30.
1:30. How's food today?
1:30.
Wonderful. She was letting me give me no kiss.
How come?
And he's been walking.
Okay.
Yeah, he had a cheeseburger. Looks like he was hungry.
BM still? Loose?
Still loose bowel movements?
Yeah, but I'm getting more gas.
More gas. Oh, that's good.
Yeah, and his tummy's still
How's
very
the tummy?
tight. Very tight.
Still, huh?
Yeah, but
Still tight?
they gave me
Something?
wrap
Wrap
around.
around?
Oh, is that why? You have a binder on now? Okay.
Do you breathe okay?
Oh, that's
Oh, okay then. So at least it
Okay.
helps you a little bit, you know, in moving around, okay? Okay, food. Lunchtime? Started lunchtime?
yes.
With soft
A little bit
diet?
late,
Soft
but
or regular?
since he was waiting, I went. We got it for him.
Regular or soft?
And
okay.
still with Foley catheter,
Uh-huh.
IV antibiotics,
Okay.
and we're changing finger sticks to AC and HS. I didn't give me-
ACNHS now. Oh, still Q6 because it's TPN.
They're going. This is going to be the last bag. They're
Oh,
tapering
last-
it down.
But still, we still have to do every 6 with TPN.
Okay.
So we're just gonna stick with
Q6 sounds good.
It's still at the 50s. Okay, that's good.
Okay, sir. I won't
you
be
walk
back
today?
tomorrow. Yes, he's been walking. I won't be back tomorrow, so you'll get a different nurse for the day shift.
Okay.
Okay. So I wish you well. Hope you have a speedy recovery.
Thank you.
I'll be here until 11:30. Okay. Good. Okay, that's good. Okay, I'll see you around. I'll be back. Okay.
Thank you.
You know, bloody in 60?
I know her too.
Okay. She had a terrible morning.
Which one? Miss Hanks.
Yeah, she has a migraine that I could not get rid of. But she's doing much better now.
Hello, Karen. How are you? Hi. Okay, so what's
Hello
new?
again.
I'm back for you tonight. Okay. You still remember my name? Too many names.
She
Marcel,
does.
Thank you. Okay.
How's your head? You starting to think about the... It's not. Okay. Okay. As long as it's better, that's all that matters.
Still cramping.
I couldn't get her headache under control, so I gave her 4 morphine. That was way too much. I would not
Yeah,
recommend
well,
doing
0.4.
that.
Did they tell you she's only okay with 0.4? I told Yoli last night.
Her head was horrible. I mean,
Oh.
just looking at her, I just...
So you only tried the morphine. That's it.
I
Did you try
did
the
ask the
Dilaudid?
doctor a little Tylenol through the NG, and we did try Dilaudid. It wasn't touching her. I gave her cold, wet towel. She was incredibly miserable.
Oh, it helped with the Tylenol.
Yeah.
That's good.
And then I did get her an order for the spray for her throat.
Yeah.
It's on the card. She
Oh,
can
that's
have
okay.
every hour.
Oh, so lozenges is not working anymore?
She did go for a short walk and also sat in the chair for a little while. Nothing out of
How
her
you feel?
NG.
Still cramping?
Just during the night it was, there were waves again of it.
Oh yeah, no gas yet. Yeah, okay. Soon, hopefully. Yeah.
Nothing out of
Brownish.
here. They
Uh-huh.
changed the solution to D5.
D5, okay.
20.
That's good.
Same
Uh-huh.
rate. She did get a bolus last night for lower urine output.
Oh, okay.
For me, she made 400, which is kind of marginal.
How much last night? Like,
But for my shift, it was 400.
400. Okay, at least we're catching up already.
As late
Good.
was a little bit
So 100.
Oh, good. I can take credit for that. I might have a little more. Let me just take a quick peek.
So 200 for you, you mean to say?
She did make a little more. I'm going to take credit
More,
for it.
okay.
Oh, yes. Wow, it's very clear.
Okay, last pain
Another
medication she had?
Not for a while. Let's see.
Dilaudid, okay, let's see, morphine. Oh, they changed the morphine.
And I got a little worried because
Where is it, the morphine?
it took a while for it.
I can't see the morphine anymore. They took it off?
No, it's there.
No, they took it off.
Oh, they took it off.
Yeah. So around 9.
Very early.
At least, yeah. So at least you gave her Tylenol and it helped, right?
Yes.
Then
Something helped. I'm
Dilaudid,
not sure if
you
it was the
did-
morphine or the Tylenol or just fluids.
Oh, yeah, okay.
But
At least, yeah. With cramping, we can use the Dilaudid. Since last night, right? And then with headache, we can just use the Tylenol. So alternate, okay?
I was vomiting so profusely
Oh.
all Sunday.
Of course, nothing in your tummy. So sometimes
Caused the headache.
it does.
that could
yeah.
too, yeah.
Because I'm so dry. These are good, but they're not breakfast, lunch, and dinner. But I'm just wondering if that's causing
Yeah,
the
sometimes
headache.
it does
Yes.
too. Yeah. Okay, I'll come back and see you later. I'll check your vital signs. Okay.
Okay,
Okay.
get well soon.
Going.
I'm going and I won't be back tomorrow, okay? So
day
hopefully when
off.
I come back, you'll be out of here. Okay. good
Hopefully
night.
you're better. And my lady. How's my lady?
Much better today.
How are you today?
I'm a lot better.
It's her birthday today.
My
Happy birthday!
Can't tell my age.
Any cake?
Almost. Soft diet. Yes.
Thank you. How's breathing?
Better. I mean, I've got breathing problems.
Yeah.
Still?
She's
oh,
got-
SP, how's
She does have pneumonia.
pneumonia.
Yes.
Oh. How's the CT scan? Last night.
Good.
Good.
Well, how do I have pneumonia?
Oh, because we weren't being aggressive enough walking you and making you use your breathing exercise machine.
More, okay? More than 10 times.
Yeah.
So this is the last bag of potassium, and after
Potassium,
that we
okay.
can say and lock her, and you can have your freedom again.
Nobody tries my blood.
You okay? Are you passing number 2 now?
Yes. Not just
Okay.
gas.
Okay.
What a embarrassing.
You look great today.
Doesn't she?
More awake.
Yes, much better.
How's tummy, hon? Okay?
So how did she deal with post-ambulation?
Number 2, ate? She had number
Not yet?
2?
Oh. So they're trying to order her oxygen today, otherwise before 4,
Oh, going
otherwise she
home?
won't go home tomorrow.
Oh, yeah.
So let me
How's
get your
lungs?
finger
Still?
Not as bad. Not as bad as yesterday.
Okay, good. Okay.
It does
oh,
hurt a
boy, what are
lot.
these bruises or?
You guys.
We did it.
Heparin? Is this the heparin shot?
She
No, that's in
refused
my
it.
arm.
What's those?
She has a small bruise like that on her back too, right there.
Okay. Take a deep breath, hon. Can you do this one?
Not good.
Okay, suck it in. It's like smelling a rose, blowing a candle, okay?
I like that.
Come on, smell a rose. No, don't blow.
91 room here.
Not so fast.
19 and 100 earlier with oxygen.
She's marginal then. That's good.
Okay?
Good.
Yeah.
That's good.
Can you smell a rose for me? And blow a candle? Like that.
Yeah.
Yeah.
Good, see? 97. Look at this. 97,
Good.
96. See, that's how you do it, okay? I'll come back and check on you.
Okay.
So, Banco just have to have the
Darling.
Yes.
Lady.
So still on clears?
No, soft.
Oh, soft diet?
Soft
No.
birthday cake. I try to get them to bring her birthday cake.
Yeah.
Maybe for dinner.
Soft diet, okay.
Okay, dear, I won't be back tomorrow, and hopefully you'll be
Oh.
out of here too.
Okay, I'm gonna miss you.
I'm going to miss you too, but you go home and you take care of your daughter.
I know. I miss you.
Okay.
Regular soft.
Take care of your arm.
I
How
will.
about that?
Did they start at breakfast time for her
No,
regular?
lunchtime.
Lunchtime? Okay.
Now, they brought me a,
Soft breakfast.
yeah, I didn't eat none.
Okay, take it easy. Okay?
Yeah, she's
Okay,
not
I'll
taking
be
it
home
much though.
tomorrow.
Yeah,
Tomorrow.
tomorrow's the day.
Okay, I'll come by and see you later again, okay?
Okay.
I'll let you push this one. I'm sorry, I don't want to hurt my arm anymore. I'll carry this. Yeah.
For me.
I will gladly push this machine
Hopefully
for
we
you.
have that one soon. Okay, so we'll just.
And they did say they were going to make carts for those computers.
Can we do her last?
Okay, yeah.
You know her?
No. I bet using the taker.
Okay. Hi. I'm signing off for the night. Adonis is coming for night shift. He'll be your nurse tonight. Okay, from 11 to 7 in the morning. Okay. So.
Okay.
Can we turn on your light a little bit, hon? Okay, so we can see. There you go. He's a 75-year-old guy. He had a partial colectomy done on January 25th.
Okay.
So he's alert and oriented. He has a midline dressing. So they open up that one and we're doing wet to dry.
Okay.
TID. So I did around 9 o'clock.
9 p.m. that was.
Yes, so he had a Foley. He has a PICC line, double lumen on the right arm. And he's getting a TPN running at 50 ml.
Okay.
And finger stick Q6 hours. And then they started him on regular soft diet today.
Regular soft.
Yeah. He's doing great. Okay. He gets up, he walked around already one time on the hallway. So here, Kuya.
Okay.
So binder, okay? So just addressing under. Yeah. So there you go. So I did around 9.
Okay.
There you go. And double lumen PICC line. And he's running on 50 ml an hour.
Okay.
Oh.
With IV.
No, he's the other one is Haplock. And no complaint of pain. Okay. And also he's getting Lasix 2 times a day. Okay. There you go. Any more questions, Kuya? Okay.
Question.
Yeah. I'll see you tomorrow. You okay? Doing okay? Weigh daily?
Daily?
Oh, wait to every Monday and Thursday only.
Okay. The potassium is okay?
Yes. Okay.
The right
So
name in here.
your number will be 16594. Okay. We have the same number, Mr. Okay, if you need Adonis, call him 16594.
Soft light.
Okay. Regular stuff. Okay. Thank you so much.
Take care.
He'll be right back, okay?
Okay. I'll be back to check your vital signs, Mr.
Okay, so we go over. Okay, so I have 2360. This is she's a 55-year-old female patient. I'm signing off for the night. Adonis will be here for you tonight, okay? This is Adonis. So she came in yesterday.
Can I turn the light on?
Here, I think we use this one, okay?
Oh, yes.
Okay. So she came in yesterday, SBO. So yeah. So she's complaining of like on and off abdominal cramps. So we've been giving her Dilaudid 0.4 IV. It helps. They DC'd the morphine. It's too much for her, 4 milligrams. So she also gets Tylenol, I mean to say, for headache.
Okay.
And then earlier around 8:45, she was like, you know, coughing up and nauseated. So the NG pulled out. So I put a new one. So it's French 16 on the left, and it's going on low continuous wall suction. There you go. And IV running on the left AC, D5 half with 20 at 125, and another saline lock on the right.
Okay.
Okay. Yes, NPO. How are you now? How's the headache? Oh, it's better. And how's?
You
Okay.
did a good job.
Yeah, okay, thank you. So she can get also the spray, kuya, the chloraseptic spray for throat pain.
Throat pain.
Yes, I gave her one time Cetacane before I inserted the NG, and it helped a lot.
Okay.
There you go. I'll see you tomorrow, Han, okay? If you need anything, we have the same number, 16594, okay? Thank you, Han. And nausea, you can get anytime soon. The nausea medicine. So just call Adonis, okay? I think Dr. Wang. Okay.
I'll be back to check your vital signs.
There you go. So you can start anytime.
61B.
So for that, 61B. Okay, so I have this. So she's a 60 female patient. Okay. Hi, I'm signing off for the night, okay? Adonis will be here for you. Can you fix yourself, hon? You're a little bit at the side. Can you help?
Side?
Yeah, can you
I can't
stay
lay
in
on
the
the
middle?
side.
No, in middle? Okay, I don't want to bump your head on the side. There you go. There you go. You okay?
Yeah, my knee.
Your knees? Okay. Okay, Kuya, she had partial colectomy done on the 27th. Yeah, so she has a midline staples. Open to air. And she has a saline lock on the right forearm and then the left forearm.
Okay.
She started on regular soft diet today. Possible discharge in the morning. I think that they're gonna order an oxygen for home. So
Okay.
she usually desatting to at least yesterday because she has a history of COPD, asthma with COPD. So they ordered oxygen for home,
Okay.
and then hopefully they're gonna deliver that one tomorrow. She gets up to the bathroom with assist. How's pain right now? Better? Yeah. So I gave her Dilaudid around about 9:30, and it helped her. So she can have that one every 2 hours if she needs it.
It's 2 hours.
Yeah. And she goes also to the bathroom and uses cane with assist. Cane. Yeah, she has a cane or walker. Where's your cane? So, right here. I have the cane on the side.
What?
Your cane. And she like ice water and 7-Up all the time.
What?
Yes. I'll see you tomorrow if I see you. They might release you in the morning
Yeah.
if you're doing okay, huh? Yeah.
Need to go home. Want to go home.
You want to go home soon. And she's also on breathing treatment, albuterol, every 4 hours. So that's it. So vital signs is stable. Yesterday, actually, she was having a lot of crackles, but she's doing better today. They gave her at least Lasix for 2 consecutive days, so she's fine. She sounds better today.
Okay.
Okay, any
Also
question?
antibiotic?
Yes, she was on Vanco and then Zocin. So Vancotrol level is gonna be tomorrow. So just remind that one for morning shift. So it's gonna be 2:30 tomorrow before the 3 o'clock dose.
Okay.
Okay. Okay, so
What time to get home?
tomorrow,
Uh-huh.
if everything goes well, probably before 11.
Oh, okay.
So if I don't see you, good luck.
Thank you.
Okay?
Uh-huh.
Okay, Adonis will be right back, okay? There you go. Mhm. And she has also, oh, that's the last x-ray done today.
Incision is midline?
Staples, yeah, midline. Mhm. So we're gonna go with Hi, I'm going home. I have Adonis for you tonight. Yeah, he'll be your nurse. I'll see you tomorrow again. Yeah, you're welcome. So she came in today with status post. Kara, 63 female. She had laparoscopic assisted colectomy and colectomy. So she got like 5 telfa dressings on the abdomen.
That's fine.
Mm-hmm. So she's on clears. And she did well a little bit, but after a little bit sips of, I think, 7-Up, something, you got nauseated. So I gave her Reglan and then Phenergan, and it,
Reglan, Phenergan, okay.
relieved well. So, and also she was on epidural earlier at 12 ml an hour. So she's on epidural 20 mics, 0.06% of bupivacaine. So her blood pressure dropped down to 87 something over 40s. So I called anesthesia. They lowered down to 8 ml now. So she's running at 8 ml
So
right
before is how much?
She's on the 80s.
No, the rate of the epidural.
Oh, so she was on 12
12 decreased.
and then decreased to 8 ml. So her
Okay.
latest blood pressure is 90 over 50. And she's also getting an IV on the left hand. And it's D5 half beat 20 running at 100 ml an hour.
Okay.
Thank you, hon.
She really has.
So I ordered a new bag for you, so they're gonna deliver soon.
Yeah, I got
Oh, you got the new one already? Okay. There you go. So
Am I gonna see you tomorrow?
yes, I'll be back. I'll see you again tomorrow, hon. Okay. She has a Foley, kuya.
okay.
Yeah, and then 5 telfa dressing. Oh, actually 6. 1, 2, 3, 4, 5, 6. And then can you turn on the side hand? So we're gonna double check your epidural site, okay?
Okay.
Careful. Slowly.
Yeah.
There
Real
you
slowly.
go. Kuya, okay.
Oh, I don't think so.
Okay. Oh, you want me to help you a little bit?
Ouch.
There you go. Good, good, good.
Is that okay?
Yes, yes. Okay. Okay, kuya. So it's thick. Yep. There you go. Good. Yeah, she's good. Good. Okay, hon. Thank you so much. Okay.
Okay.
Okay. So earlier she was complaining of like sharp pain when she came up on the floor. So instead of giving her the bolus because of her blood pressure, so I just called anesthesia to give me a breakthrough pain medication.
IV?
Yeah. So I gave her 0.4 and it helped her well with this one. So anesthesia said it's okay. You can give that one
Okay.
for breakthrough.
Here for
Because I'm afraid to give her the bolus earlier because her blood pressure was on the 80s and 90s. So I don't want to drop down more. To the floor. You okay?
And my
I
belly
know,
button
your
hurts
belly.
a little.
Okay. Good.
Can you lift my head a little bit?
A little bit, okay.
It helps me to breathe through right there.
Is that okay? So a little bit more.
I think that's
Good. Okay. So it's 56.1 left, running at 8.
56.1. Okay.
Mhm.
20 mic, 8 ml an hour,
56.1.
56.1. No
No numbness.
numbness.
So hopefully tomorrow we'll try to walk around, okay? In the morning.
You're gonna give me some drugs before that,
Yes.
right?
You're gonna have that medication.
Good.
So we'll try to get out of bed tomorrow. Okay. And she's been using her Triflo well. Okay? I thought
Put somebody's
fell.
Okay, ready? Clear? Accept.
Accept.
Well, where's the call thing here?
Oh, call button, hun, right here.
Oh, there's
You want it beside you, or you can reach it.
it's okay.
Okay. So don't forget to use this one, okay?
Oh,
Okay, that's it.
here's my phone.
Okay, any question? You okay?
No, I'm okay.
No. Okay. See you tomorrow.
Okay, thank you.
You're welcome.
Update the board.
Clear liquids.
Liquids. What's the doctor?
That's Dr. Kim. Lucy Kim.
And she'll be by in the morning?
Yes.
Okay.
She'll make rounds tomorrow morning. Have a good night, hon.
Thank you.
You're
Thank you
welcome.
once again. All the good care. And all the good drugs.
You have a good drugs.
Okay, thank you.
Thank you. Okay.
So, good night.
Good.
It was 9.1. I think it's 9.1 now. 0.4, it came out 10.29.
Alright. Chabra yesterday, Suzette? Yeah. Alright, so you already know Suzette. She'll be your nurse for this morning. I'm gonna go home.
We remember each other from yesterday.
I know. 65 female. She came here for angina, and she has history of cabbage in 2006. So she had a stent yesterday, ×1 to the PDA. So right groin's open to air now, but we put a little band-aid on there. Manual pressure, no hematoma, no bleeding. Pulses were fine for me. Lungs are clear. already walked around the room to the bathroom also. The only thing, she's gonna have the Foley in until she goes home today. She wants to leave it in until then, and then just take it out afterwards. Blood pressure, vital signs, those are all okay. Heart rate's been normal, but it's been staying in the 50s, so I held the Coreg this morning.
Okay.
The lowest it got for me probably like 44. But it's been mostly staying in the 50s.
Okay.
Labs look
Labs
good.
look good?
Mm-hmm. Yeah, and they did the EKG this morning already, all done. So she's ready to go home.
Okay. And your husband's gonna be coming today at 9?
Mm-hmm.
Okay.
Yeah, and the IV site looks good. No fluids anymore. So just the Coreg I didn't give this morning. The rest of her medications I gave, her Lovenox and her levothyroxine.
Okay.
And no other issues overnight. She just got really cold this morning.
Okay.
All right.
All right. I'll be back for you. I'm gonna get a report on my other patients.
Thank you.
All right.
Thank you.
You have a good day. You take care, okay?
And you too. Thank
I
you
know.
so much for your
Hope to
help
not
with
see you here again. Not for a while. Take care at home. And no pain overnight. Vicodin, though, she can have every 6 hours if she needs it. But she didn't need it last.
Am I going home with Vicodin?
I don't know. The doctor will come around 8 o'clock and they'll discharge you with whatever medications that you're gonna go home. But hopefully before 11 o'clock today, they'll explain everything to you. Yeah, and you'll go home before that.
She had Vicodin overnight?
No pain.
Okay. Thank you, lady.
Thank you.
Always a pleasure.
You want your lights off or on? Okay. All right, you take care at home.
Calling.
She's coming.
3.3. Blood pressure stayed in the 90s for me, so I could not give them metoprolol and the Lasix this morning. Other vital signs were stable. The only thing, his heart rate still in the 100s, 110s at times, but mostly low hundreds, 90s, low hundreds. He's on 2 medication drips, heparin. Let me check if the anti-XA is already up so we can adjust it. It's still at 1,200 units.
Thank you.
And the amio, I already ordered a new bottle for you. It's still at 1 milligram an hour, a minute. Let me just check so we can just adjust it. 0.15, so it's therapeutic. It'll change every morning. Lung sounds for me still crackly, diminished at the basis. Had a bowel movement yesterday. Everything's open to air. I started a new IV site on the right AC. Right forearm is new. So heparin is on the right AC, and then the left forearm, the amiodarone, they're not compatible. Okay, so 2 separate lines. No pain overnight. Gets out of bed. With assist, still swollen on his legs, +3 pitting edema. And his weight was still the same as yesterday, 114.3, I know.
Yeah. You want me to say what I...
Okay, we're gonna hand off on the heparin and the amiodarone.
Okay.
Did you get enough sleep last night?
Did I get any sleep?
Uh-huh.
Sure. 2 or 3 hours. I think that's normal.
That's normal. Being here in the hospital. So, anti-XA 0.15. I changed the heparin bag, change of my shift, so
Okay.
hopefully you have enough for yours.
You know, people have always said that I had a fuzzy face, and it's gonna really be fuzzy now. I understand. So.
And you already know about the left tear on his face, and then the bottom is still
looks much better.
better though. It's almost healing, and then the bottom is still red, open on the coccyx, tailbone area, and Doppler right there for his pulses. All right. I'm off, so I'll see you when I come back.
I figured you were off.
I know, I
when
told
met
you.
right?
So you take care today, okay?
Then I'll try and find out when physical therapy is again for you, okay?
Yeah. Okay.
Did he walk
Could you
around?
put my head down a little bit?
Yes,
A little bit more?
Yeah.
Okay. Tell me when.
That's good.
Right there?
Yep.
Okay, so 0.15, no change. Continuous, no order to decrease it, because I think the heart rate needs to be controlled. Okay. All right, your turn. All right, Mr. Mannequin.
Okay, I have a replacement of aortic.
Yeah, replacing ascending aorta. Suzette is back, so she'll be your nurse again. Let me connect you to the blood pressure machine again. Replacement of the aortica, the ascending aorta. Day number 3 already today. Everything is out, no more chest tubes, no more wires. I already painted the incision with betadine. I changed the dressing just on the bottom. It's still oozing a little bit.
Okay, good.
So when it dries out, you can just take it off. Lungs are diminished for me. He had a bowel movement this morning. The legs are fine except for the left leg, still more swollen than the right. But the DVT for the ultrasound to rule out DVT yesterday was negative. So, but they're thinking of possible cellulitis, so they started him on Keflex. I gave twice last night, and I gave him Dilaudid for his pain just a few minutes ago, and also Percocet. He can have every 4 hours. The next one is at 8:20. How's your pain now?
Better.
Is it better? How is it from 0 to 10?
A 3 or 4.
Like a 3, good. So it's a 3 now. Let me just reassess it on here, Susan. So I'd been just putting the warm compress on the left leg. The pain is more on the leg than the incision. But he got out of bed okay this morning. Minimal access to the bathroom. Sitting up in the chair. So plan is just to maintain his blood pressure again between 80 and 120s. But the thing was, last night it's been over 120, so I'd been giving the hydralazine and the metoprolol, IV PRN.
The metoprolol is now 75, right?
They increased the pill.
Yeah.
But I gave the IV and the hydralazine. I just gave also this morning. It's still above 120, so hopefully the metoprolol PO, the pill, will start kicking in. And I think they put him on more blood pressure medications.
Yeah.
So the last time I gave hydralazine was, just show you here.
The hydralazine doesn't seem to be working. I gave it yesterday too, and it just, I told Dr. Lee about it. Just check your incision here, okay?
I gave it at 4:30, so every 4 hours. Okay. And the metoprolol I gave at around 1, so if he needs it. But then the heart rate went down to like 60s right away. Okay. So that's why I didn't want to give it, since I just gave the pill anyway this morning. So okay. So that's the only thing to control the blood pressure, and then the left leg pain, just to make sure that it's been okay. Okay. All right. Let me just assess his pain really quick. Right here. Good 3 now. I'm off for a couple days, but I'll see you probably on the weekend. I don't know if you're still gonna be here.
Thanks for everything.
You have a good day. You take care. All right, I'll be back. Mrs. Zet will come back. And heart rate's been okay. Mr. Morning. Okay, so listen. I'm gonna go home. Suzette will be your nurse for this morning, okay?
Okay.
All right. So this is Miss 86 female. Had an MI non-STEMI, so they did a cath yesterday. Okay. Times 1 to the left circ, right groin, angioceal, open to air already. She's been ambulating in the room. She did fine. Only thing is a little forgetful, but she's been calling, using the call light. 2 to 3, she knows where she is, the date, and what happened to her. But she got out of bed last night, so it alarmed, so it's on bed alarm right now. Lung sounds diminished. Pulses, Doppler pulses also, so I've been borrowing that one from there. Excuse me. A lot of bruising around the arms here, and also this one is hard.
Blood pressure cuff?
No, it's been there before. Dr. Lee's aware. They said that he was gonna look into it today. It's painful to touch. She said.
Just gonna check your groin here, okay? Okay. There's a curtain there, please.
And heart rate is 50s to 60s, but mostly stayed 60s for me, sinus rhythm. Also, she's on Cufflex for UTI. Right here? And
no, I don't hurt that.
Okay.
I hurt here.
Right here?
In my chest, yeah.
In the chest, the breathing problem last night. So she got their treatment yesterday. She's coughing a lot and wheezing also.
Is she getting around the clock?
No, I think it was just a PRN. We called Dr. Lee about it. But she can also have albuterol every 4 hours. But she's not wheezy anymore, not as much as last night. And blood sugar checks for her.
Very, yeah, I'm gonna have to get the Doppler.
Yeah, you can't really feel the pulses. Just the Doppler. They're marked, right?
Yeah.
They're still marked. And no pain overnight, just the congestion and the coughing. It makes her chest painful. But other than that, she did okay. She slept pretty good.
Yeah, I have to say something myself. I've been a member of Kaiser's for many, many years.
Oh.
And this hospital is about the best. The people,
Thank you.
The people are very helpful, and in time, and the food is good.
Oh, good.
Yeah, well, because it's cooked,
Hey,
it's
the
not
food is
dumped
good.
in
That's good.
things, yeah.
I know.
So I can say that I would recommend that whoever needs to go to a hospital, this is a good place.
I'm glad. We're glad. And also, let the family know a couple hours before discharge.
Oh, okay.
The daughter, Nancy's your daughter?
Yeah.
Yeah, so they live far away, so they want to make sure that they know what time she'll be going home, so they could come here on time. So I think her number should be here.
Is it there in the demographics?
Yeah, Nancy Samuel. It's good. Demographics. from
So-
Castro Valley. So.
So she's already walked and voided okay?
Yeah, she's been walking around actually. Voided fine, used the bathroom fine, no problems overnight.
And yesterday I was taken with an ambulance to, I'm forgetful, to have my heart, what is called when they do the surgery and whatever. See, I'm very forgetful. So,
That's okay.
no, yesterday I had all three of my brothers came with me. I mean, they went by themselves, and I went from here with an ambulance. And I waited for a while, and the doctor who worked on me is a doctor that used to work, I think, on his own, because he gave me heart surgery, you know, the through the bottom part, before twice, but he was in another place. I mean, he worked then for somebody else.
And IV fluids 30 ml for now, normal saline.
Are you doing blood pressures on this side here or the other side?
Just lower here.
Okay.
It's more accurate than that one. That's
Okay. I have here things too.
Yeah, she has a liner also. All right, miss. Have a good day, okay? Suzette will take good care of you. You're gonna go home today.
Let's just take your vital signs here, okay?
Okay.
You're logged in, Suzette, right?
Yeah.
Oh, okay.
And the nurses are really good. Whenever you call them, they come.
Did you come from home or did you come from another hospital?
Here?
Yes.
At this time, you mean?
You said you called the ambulance?
Well, it was your ambulance. I didn't call it. You guys
okay.
called it. A very nice gentleman.
Oh, we're done. Thank you. Hey, Vanessa?
Yeah?
Can you grab me that thermometer there before it's all gone?
Oh, I see it.
So what did that feel like to you when the nurses came in to talk at shift change in front of you?
I enjoy that. Every shift change, 3 times a day.
You do?
You get that, sure.
What do you enjoy about it?
Oh, I enjoy conversing with the nurses or nurse.
Yeah.
In some cases, it's a man nurse, and so you've got no family to converse with. It's enjoyable.
Yeah.
So and I like to talk.
Yeah.
So,
what would it feel like to you if instead of the nurses coming here at shift change, if they were outside of your room? How would that be different?
oh
or
no,
not?
that's sort of impersonal. Yeah. They do things like, well, I weighed myself this morning.
Yeah.
I weighed myself yesterday morning. I weighed myself the morning before, and I weigh more each day.
Ah.
Yet, I'm not supposed to be weighing more. I'm supposed to be weighing less.
And how did you find out that you're weighing more?
Oh, I can see it on the scale.
Oh, okay.
I step on a scale.
Yeah.
And, I'm given Lasix to cut down on fluids.
Okay.
And I don't drink much or eat much. This is day before yesterday's fluid, and yet the weight is going up, not down.
Yeah.
So anyway.
Can I ask you something? You
Sure.
were mentioning earlier about the number of days you've been here.
Yeah.
Was that?
I had surgery on the 24th.
Yeah.
Replaced a aortic valve and a tricuspid, tightened a tricuspid valve.
Yeah.
And that's all, as far as I know, that's all they did.
Okay.
And so I was in CC, I can't even pronounce it. CCU
Yep.
from Monday afternoon, Tuesday, Wednesday, Thursday, Friday. I came to this place.
Okay.
So this place is only down the hall, right?
Right.
Yeah. So, but
Right.
there, the difference in care there, you probably already know, but is that when you press the button, you don't have to press a button. You've got a nurse standing over the top of you
Yeah.
the entire time.
Yeah.
So
Yeah.
yeah, so it's a one-on-one thing.
Yeah.
Here it's 1-on-4
Yeah.
or 1-on-3,
Yeah.
and which is nice. You get there it's generally male nurses.
Yeah.
Here it's a combination.
Yeah.
So
You mentioned shift change. Do you know what time shift change happens?
I believe it's at 11 o'clock at night, or
Yeah.
11 o'clock at night till there's about a half-hour overlap of shift change.
Yeah.
Yeah, and I'm usually awake,
Yeah.
because they change the shift, and then they go on to change the shift at the next patient,
Yeah.
and then after that's all done with, they come back about an hour later and wake you all up and do everything again. So anyway, it's a lot of fun, right?
Yeah.
Anyway,
Well, great.
I probably get to watch the snowed out Super Bowl in that little
Right.
and
Exactly.
I have a 60-inch Sony at home.
Oh, nice. Well, that'll be nice to get back to.
Yeah, well, it
That'll be
will.
Nice to get back
but-
to. Well, sir, thank you so much for
You're quite
letting us
welcome.
chit chat with you a little bit.
All right.
All right, I appreciate it.
Will you?
And we'll blur you out, Mr. Fuzzy Face.
I don't care if you blow me out or not.